Okay, good afternoon and welcome to the Nurse to Nurse monthly webinar. Today's topic is strengths of character, empathy, stability, and communication. We want to thank everyone that's joining us live, as well as those of you that will be watching this after it's posted. We totally appreciate and understand that our nurses throughout New Jersey are busy, and sometimes you could join us and we love seeing you, and other times we appreciate when you're able to watch our webinar, if it's tonight or a few days or a few weeks down the line. The most important thing is that we're sharing information and we're all connecting. My name is Ravi Maharaj, and I'll be your Zoom host behind the scenes. If you have any technical questions or if you need any assistance, feel free to text in the chat and reach out, and I'll definitely be able to help you as best as I can. We're also here if you have any questions during our presentation. So we're going to advance to the next slide. Here we go. So I'd like to introduce Barbara, also known as Babs. She's going to be taking over, and she's our main presenter for today. So Babs, I'm going to hand off to you.
Thank you, Ravi. Hi, guys, and hello, everybody out there that will be watching later. Thank you for everyone that can attend today. I am very excited to present today's webinar to you on strengths of character. First, I want you to meet part of our Nurse to Nurse team. I am right there in the middle. My name's Barbara Brilliantine. I go by Babs. It's just kind of stuck with me. I do have 24 years experience as a nurse, and I'm the lead peer support specialist here at Nurse to Nurse. A little bit about my background. I have worked in many different areas, but the main areas have been maternity, and I also worked in a correctional institution for a while. And in the slide there, you will see Cherie Castellano. She is our director and also the creator of the call center here at UBHC Rutgers. And then to the right is Michelle Julian. She is our mental health specialist, and she will be presenting as guest speaker a lot. Next, please. Right now, we would love to hear from you. You can either write it in the chat or just unmute yourself and talk. We'd love to know your name, what you do as a nurse, how many years you've been working, and also a very important question to start off this self-care topic. What is your resiliency word? I can tell you that mine is perseverance. Perseverance is something that I hold strong onto because it has gotten me through so much. So please, is it Lubby or Luby in the chat? Well, it's a pleasure to see you here. Anybody else? Name, years, working. What unit do you work on? If you want, like I said, you can unmute yourself. Free to talk. And your resiliency. Oh, you can't unmute? No worries, hon. Totally get it. Thank you. Thanks for joining us. CNA at Newark. Oh, that's excellent. Love 10 years. Veteran nurse. Good to see. Yeah, we welcome all nurses. Still those in nursing school as well. Yes, Melinda, 15 years experience, all different units. A veteran and completely cross-trained, I'm sure. Ooh, Sharon, 12 years as a pediatric nurse. Patience is my word. That's a big one, isn't it? For all of us. We not only take care of patients, but we have a lot of patience. Dun-dun-dun. That'll be the last terrible joke, I promise. All right, so thank you and welcome everyone else. Welcome. Let me talk first a little bit about Nurse2Nurse. We are a reciprocal peer support evolution. What does that mean? Reciprocal means I give to you and you are giving back. Our callers do not realize they are giving back, but they are. Every nurse that answers the call line here at Nurse2Nurse, it is a nurse, and we care a lot about our peers. Something that's evolutionary about this call line is that we take care of these unique populations. We rescue the rescuers. These are high-risk populations. Who are we talking about here in the call center? Not just the nurses, that's this line, but also the call center takes care of cops, mothers, social workers. These are our caregivers who give. But there's a time when you need to receive for yourself. Take care of yourself. And that's what we are trying to teach and include everybody on. Also, what makes this program so special is we have a shared live experience. So for this line, we are all nurses. We kind of talk the same, we think the same, and in my opinion, the biggest thing that connects us, we have the same nursing heart. And I don't think I need to describe that anymore. I think we all know exactly what that means. We are based on evidence-based practice. A study that was done, a reciprocal peer support model that was done in the 90s. So this is evidence-based research that we go on, and that's the model that we follow, which adds to why we have become one of the most successful peer support lines for nurses, as well as the cop-to-cop, caregiver-to-caregiver, and the mom-to-mom. Next, please. Nurses are first responders. You are the rescuers. I know that us caregivers, we don't like to take compliments, and we don't like to hear this at all, but here at Nurse2Nurse, we are other nurses. We get it. We know you. We know how we know your hearts, how good they are. We know your strengths, how tough you are. We know your knowledge, how smart you are. But you are the rescuers. I want you to remember that. And rescuers need to be taken care of. Next slide, please. A little bit about Nurse2Nurse is we are an initiative of the Rutgers Behavioral Health Care and the New Jersey Initiative. We are grant funded, and that is by the New Jersey Pandemic Relief Fund, as well as the New Jersey Nursing Initiative. This last part, I can't stress enough to all of you. We are not affiliated with any nursing organization or hospital, healthcare system, or any facility. This is confidential. This is anonymous. There's no reporting to anybody. We're not affiliated with anyone. This actually makes us a little different from, let's say, your EPA or your wellness programs in maybe the institution you're working from. We are just a separate entity, just here for you, just you and us. Next slide, please. This is our flyer. If you would like a copy for yourself or your institution, you can put your email into the chat. And I know Ravi said this will be recorded, but the chat will not be recorded. And I'll repeat that, anything in the chat will not be recorded. We take that out. Okay, next slide, please. What do we offer here? What are our resources? We have the live peer support helpline, and we have an ongoing one-to-one peer support. So what that means is you will be, when you call, it can just be for a moment. If you just need that one moment to talk to someone, let some things out, totally fine. But what we like to do is we like to check in on you. So after you give us permission, we will then call you on a weekly or bi-weekly if you need it, even a monthly basis to say, hey, how is Luby doing? Hey, how is Melinda doing? Hey, how's Sharon doing today? And through my experience is, even though most people say, okay, yeah, I'll take the call. Nurses, most people don't ask, hey, how are you doing today? And that is exactly what our call is, saying, hey, how are you doing today? And you would be surprised how things just flow out of you when somebody calls you, especially a fellow nurse. We also have online chats. You can find that on the website, wellness webinars, as we're experiencing today. You can find us on social media. We also have outreach events. In case your institution would like a wellness event, you can always get in touch with us for that. We also have a provider network, physical health and psychological health. We have doctors that specifically are trained to work with nurses. Again, they know our hearts. Next, please. This is our webinar series. And again, if you would like a copy, you can put your email into the chat. Today's is strengths of character, empathy, stability, and communication, which we're going to start right now. Next, please. Okay, this is going to be fun. These here are, there is an institution called Positive Psychology, and they've come up with 24 character strengths for all people, not just nurses, but all people. If you can just take a look right here and let us know which 2 character strengths you most identify with. I will give you a minute to look through. I can, I'll kind of fill in the moment by telling you that mine is perseverance, and by the way, you can probably pick all of them, but mine is perseverance and love. I was going to say kindness, but I'm going to go with love. So please, in the chat, let us know what yours are. Would love to hear from you. I'll give everyone a moment. I know there's a lot to pick from, but you are nurses, and I know you can probably say you have all of these, but there's 2 that probably stand out most to you. It's wonderful. Lubby, I hope I'm saying your name right. Am I? And curiosity and humor. Love that. Most people would have said I would have picked humor, so I'm really loving that. Luby, got it. Got it. Hey, no one knows how to say Babs either. Everyone calls me Babes when they see it written out. All right, anyone else? Oh, Sharon, yes. Curiosity and teamwork. Love that. Nursing is all teamwork, right? Can't do it on your own. Can't save that life on your own. Anyone else want to chat in before we move on? Okay, next. Those were fantastic, and very nursey answers. So thank you guys for that. Appreciate that. What is character? Let's start there. And I love this diagram here. So it's the intersection of your thoughts, your feelings, and your actions all together. That is character. It's not fixed. This is a very malleable thing because guess what else is malleable and moves around? Your thoughts, your feelings, and your actions. However, there's always kind of a pattern that emerges in you for your thoughts, feelings, and actions. That is right there, your character. But like I said, it moves around throughout life. It's a lifelong endeavor, continually changing through our life. You can develop character more, or you can lose a little character, depending on what's going on in life. And that's okay. But character is actually a big nursing strength. We are very strong in character. Next, please. The top 3 strengths supporting nurses: empathy, stability, and communication. So here at Nurse2Nurse, after receiving the data that we collect in our program, we've come up with these 3 strengths. And you'll see that each of these are straight from that positive psychology 24 strengths. So empathy, what we found is that it's connected most with love, kindness, and open-mindedness. Stability, that is how we take in emotions and then react. Stability, perseverance, integrity, and perspective. And then communication, connection, open-mindedness, and teamwork, right? That's so important, as we pointed out when Sharon pointed that out. Next, please. As great as character strengths are, they can turn into challenges. Let's see if you guys recognize any of these challenges. Again, this is things that Nurse2Nurse data we've collected from our many callers. It's kind of what's repeated again and again. So teamwork, when you have, let's say, too much teamwork in your head, you're thinking, I need to do for the team. I need to do for the team. But there might be unequal cooperative effects with other people on the team. This can lead to resentment. Forgiveness, always giving up too much forgiveness can always lead to giving a pass, which also leads to resentment. But the underlying feeling that you feel when you have too much forgiveness is you feel like a doormat. Bravery. Most people don't think that you can be too brave, but yes, you can, because you have an inability to acknowledge your own limits. So, for example, you might be brave that you say, I want to take the next patient coming on, or sure, I can get that to you by 5 o'clock. When in reality, it's not doable. You're going beyond your limits. You can't say no. That's a little too much bravery. Perseverance. I can handle it. Come on, every nurse, we all say, I can handle this. But too much of it, that leads to caregiver burnout. And I understand that so much of our perseverance these days is because we have to. I do understand that. But there are ways to cope with that. And then lastly, open-mindedness. Accepting everything can lead to confusion of beliefs. And I find this one very interesting. And I'll give you an example to exemplify this. For example, I worked on maternity for about 15 years, and I would see a lot of domestic violence with pregnant women. And I don't, I can't say that my values say I accept that as normal for any reason at all. However, when you see it time and time again, you think that you're being open-minded by saying, oh, well, this is just their household, or, it causes this confusion. So too much open-mindedness can also hinder nurses. Next, please. All right, so nursing challenges with communication, empathy, and stability. Again, our data from our callers. Communication, not being heard by management or coworkers. That's a big one, as well as not having the time to connect with patients. And by the way, the reason why I'm bringing up these challenges is because I have some great techniques and methods to handle, to do some self-care, to be able to take care of these moments, take care of yourself in these moments with these challenges. We want to keep your strengths a strength. So communication, not having time to connect with patients. That's always been a problem, and it's even bigger now. Empathy, taking on other people's problems as our own. It's great to be empathetic, but sometimes nurses sit with it and it collects and we can't let it go. That's where a challenge begins. And stability, reacting negatively due to an outside issue. Let's say such as having a difficult patient or just being very burnt out. These are outside things that are now coming in and disrupting our emotional stability, which maybe makes us react in a way that we would say to ourselves, that's not my character. Like, I don't feel like myself because I normally don't react that way. That's what I'm talking about here. Next, please. So we're going to start with empathy. And I am going to be talking for a little bit, but very soon, I think the next slide, there's going to be more engagement. So I do want you guys to know that. Just these are heavy topics, and I just want to make sure that we all understand exactly what is trying to be presented here. Challenges of empathy for nurses. So we feel other stress, anxiety, and anger in our own body. We've all been there. You have a patient that's not feeling well, you can feel their emotional pain of not feeling well. Sometimes you can even feel their physical pain. Like if they say, oh my God, my back hurts so bad, you almost feel it yourself, which that empathy, that's a beautiful thing that we have, but too much, not so good. This unbridled empathy I'm talking about, this too much that sticks around, it can lead to high amounts of cortisol in the body, making it difficult to release your emotions. I don't know if many people know that, but cortisol does that. It creates a limited space in us, in our brains, in our bodies, to release emotions, which can then go to the next point, makes nurses susceptible to depression. Also, with empathy, when we start to intake it and not be able to release it in any way, we feel more responsible for relieving their pain, whether it be physical, mental, emotional. We feel that responsibility, and it might really affect us during our day. We also have an extreme need to fix their problems and make them all better, when really we can just be empathetic in the moment and be present and be there for them. Okay. We don't have to carry it around, guys. Okay, next slide, please. All right, tools to help nurses with empathy. So I'm just going to read this here. We accept, appreciate, and encourage expression in others by observing our own reactions. Key point, and then letting them go. What I was just saying, that be present in the moment, even if it's for 30 seconds when you're in the patient's room because you have limited amount of time. They can feel when you are being empathetic and you are present and there with them. But then you have to figure out a way to let it go. So that's what we're trying to help you with here. You can foster this awareness with the following exercise. By the way, these things that we're including today, they can be used in your daily living. They can be used, it doesn't matter what kind of nursing you do, what your day is like, whether you're sitting at a desk for most of the day, on the computer with emails, or if you are right there on the unit running around. These can all be implemented. So for a moment, if you will, none of you are on camera, so you should feel a little more comfortable doing this. By the way, I did this before the webinar. Okay, first, relax. Breathe and release the tension in your body. In through the nose, out through the mouth. You can close your eyes if you'd like to. Detach. This means clearing your mind of thoughts, which is so hard to do these days. But go ahead and keep breathing. In through the nose, out through the mouth. Clear your thoughts. Drop your awareness to the center of your body, right to the navel. Feel yourself breathe in through the nose, out through the mouth. Some people like to put their hands on their navel to feel the sensory feel of each breath. Then at that moment, what I want you to do is choose one or two keywords that you want to feel at that moment. So right now, if you want to feel calm, you can say it just in your mind. You can say it out loud. In the nose, out through the mouth. Calm. Your brain picks up on that. Your body picks up on that. Is anyone doing this? And can you tell me how you feel? In the chat. Peace. That's beautiful. Anyone else? In through the nose, out through the mouth. Calm. This only takes 10 seconds to do. If you're in a rush, if you have more time, a couple of minutes in your day, very relaxed. It is, isn't it? And can you imagine when you've come out of, let's say, a patient's room, and you're feeling all the pain, or let's say a coworker just kind of emptied out on you a bunch of anger that they're feeling. Or let's say a nursing student's having a tough time and they just talked about all their anxiety. And now you have that in you. Take a moment to cope with it by releasing it with an exercise like this. Again, if you have 10 seconds to do this, it will make a world of difference. I promise you that. Another tip and thing that you can do for yourself is you can habit stack gratitude into your day. Habit stacking is taking one habit that already exists in your life. Let's say such as brushing your teeth in the morning. And I know I have here washing your hands. Hey, either one you want to do. But okay, since I wrote it here, washing your hands during the day, because nurses do that a lot. And by the way, all of this stuff will become automatic for your self-care, and it will build, and you will notice a change in yourself, in your insides. So habit stacking gratitude. You're taking one habit and you're attaching another habit to it. So every time you go to wash your hands, and what I want you to do is pair it with thinking of one thing you are grateful for. And I'm not talking about just in the moments of high anxiety, I'm talking about all the time. That way it's automatic. It snaps right in. So when you're having that bad moment, you turn on the water, you start washing your hands, it's automatic that you think, oh, my 4 nephews. God, that'll make my heart big right away. What do you guys think of that? Does that work for you? That's okay. Ravi, next slide. Challenges of stability for nurses. Okay, no matter what type of nursing you do, nurses experience trauma. These emotions can pile up, causing negative reactions, not just to patients and coworkers, but your loved one, because it spills over. This emotional pile of emotions, oh, say that 3 times, can also hinder our problem-solving skills. This is a nursing superpower, is our critical thinking. But when there's so much from the outside that is affecting us, it is hard to maintain that the normal character that you have with your normal reactions. So how do nurses continue to care when constantly witnessing these unsettling experiences? And when I say unsettling, it doesn't have to only be a very sick patient. Again, it can be a coworker that's upset. It can be a nursing student that you're trying to teach that has fell into anxiety and seems to be in a spiral. We feel that, and then the next student that might come up to us, we might react different to them. But there's a way to maintain our stability. Next slide, please. So tools to help with stability. And I can't stress enough, these tools might seem simple to you, but simple works. You know why? Because simple can be implemented into your day, into anyone's day, even a busy nurse's day. And they have a huge effect. A little thing with a huge effect. That's what we're going for here. So tools to help with nurses' stability. First, you gotta you gotta avoid those negative coping strategies, such as a little too much food, a little too much alcohol, or drugs of any type. These only mask the stress at the moment. It's not, that is a little thing you're doing that only has a little result. Again, we want that simple thing you're doing for a large result as it builds. So journaling. This does not mean that you have to sit down with a pen and paper and journal, today my day was blah, 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 blah. Of course you can do that. That's a beautiful moment to just focus on yourself. Maybe take 15 minutes at the end of the day, in the beginning of the day, in the middle of your day during your lunch break and writing out things that have happened to you and how you feel about them. Or again, make it simple, guys. The words or phrases that you are feeling, get it out of you. Get it out. Put it on a piece of paper. Sometimes you can't talk to someone because you're maybe maybe you don't want to, maybe you're not ready to be vulnerable, or number two, maybe there's no time in your day, but it's got to go somewhere, or else it's going to affect your reaction to all these other people, including your loved ones. And none of us want that. We want to be our true selves in front of them, our authentic, beautiful nursing heart selves. So jotting down 3 words or phrases in the moment. And how I like to think about it for nurses is we always have a pen and paper of some sort in hand. We walk around with our little nursing sheet with our patient report. Why can't you flip that around after, let's say, a negative experience with either a patient, a coworker, a boss, the guy that's supposed to fix your car, any of those, and just turn that around and say, I am angry. Guess what? How long did that take? 4 seconds? That is what I mean by journaling, just getting it out. Or if you want, you can write out exactly what happened. It's out of your body. You're going back to emotional stability when it's out of you. Release it. Also, using a peer support line like Nurse2Nurse to talk about the event. This needs to be processed. And again, it doesn't need to be formally processed. It just needs to get out of our system. We need to release it. And another idea I'm going to tack on here is some of us have a trusted coworker that you can just grab and say, I'm really upset. I feel like crying. Sometimes I will tell you that a lot of times when I have done that, I automatically have felt better where I didn't even need to tell the story. Sometimes it's a little deeper and you do. And if they are a trusted coworker, then it provides the space for that vulnerability, and they usually will take a moment for you. But also, I'd like to extend it to when there's a bigger crisis on your unit. You might think that you're the only one feeling these feelings, and that can be a very lonely place. So I would even say for nursing managers and leaders to create a team when a bigger event happens, for those people to welcome everyone. Hey, do you just want to talk about this? 20 minutes in our day. And guess what? That 20 minutes, very important. Why? Because it's helping with your stability, how you're going to react to everyone around you, all the people you're collaborating with and such for the rest of the day. So it's worth it. These are things you can do for yourself. Again, simple, big effect. And once you start doing it all the time, becomes automatic, and you are going to feel so much better. I guarantee you. Next slide, please. Challenges for of communication for nurses. I think we're all going to know this list, but I'm going to just read it through. It's hard to communicate sometimes. Why? For nurses, lack of time, shortage of nurses, diversity in patients. You're dealing with human beings here that comes from all different ages and cultures and genders and religions. That's a lot of pivoting, and that's a lot of adapting, which is one of our strengths, but that's a lot. But it can also interfere with communicating. Patient family interference, being overworked, caregiver burnout, right? If you have a patient their anxiety, their pain, and their overall discomfort of being in a hospital, a lot of times it's not getting inputted. Even if you've said it many, many times, you know, sometimes it's not working. The hectic work environment. I don't care what you're doing as a nurse. It it's very hectic in the environment you're working at, and feeling like you're not being heard or seen by management. That can make you feel not appreciated. Again, something you can journal real quick when you feel that moment. But it's also a challenge for communication. Next, please. Tools. This is one of my favorites. Practice the pause. Stop, pause, breathe, reflect. Let me explain. Here's the exercise, which I encourage all of you to do right now. I would actually like you to take this moment to do this as a little self-care minute for yourself. You deserve it. First thing, visualize you can shut your eyes if you'd like to. You can visualize a stop sign in your mind. Gets your attention, right? Visualize that. Boom, that's your trigger right there. When you are feeling anxious or overworked, burnt out, angry, frustrated, see the stop sign. When you're feeling negative, see the stop sign in your mind. And then, again, you will automatically do this. Breathe 2 or 3 breaths in, just to start. Again, in through the nose, out through the mouth. Again, in through the nose, out through the mouth. One more time. In through the nose, out through the mouth. Now keep breathing. Well, obviously keep breathing, but keep breathing in this calming way. But here's the thing, is I want you to add a meaningful affirmation on that third breath, such as, I am brave and capable. So we see the stops, we feel, let's say, angry. You see a stop sign in your mind. Boom. You are now taking your deep breaths. Keep going with that. This is rewiring your autonomic nervous system, and it's calming it. So you're taking care of that physical. 3 of those. In and out. Then I want you to say your phrase, your affirmation. This is the one, I am brave and capable, that I decided I was going to use today before the webinar. This can be done, again, within a minute. You are going to realign yourself so that when you go to speak, it's going to be not clouded by any of those challenges that we just saw for communication, because you are stabilizing your mind and your heart, your beautiful nursing heart. Good time to do it, and that's why I put these under bullet points. Pause and practice this pause between patients. Again, it's a minute. I don't have a minute. Then do it for 20 seconds. Get 3 breaths in and say your affirmation. But make sure it's an affirmation that's meaningful to you. Pause before and after speaking to coworkers, management. These are times, usually with patients, coworkers, management, when you're at work. You can do these at home as well. These are the times when our emotions might be triggered because we might be in a rush. It's like, just come on, hurry up. Our anxiety builds. Hey, right after that meeting, stop sign. You see it in your mind, you know to do this. Also, what helps with communication, and I can't stress this enough, with anyone you're talking to, is using clarifying and paraphrasing. Clarifying is repeating exactly what you think they said from your perspective. So I'm just clarifying. You said you want me to go at 1:45 for the 2 o'clock meeting. Paraphrasing is usually used when there's a bit more in the context. So you're kind of bullet pointing or remembering the topics that they just pointed out, and then what the meaning was behind it. And I'm telling you, this can mean the world of difference. Using all of these things, simple, big results. Okay, next slide, please. All right, here's a little engagement. I'd love to hear from all of you. So far, you've been fantastic, and thank you so much. Which character strengths do you think arise in nursing frequently? So the two that I pointed out, just to exemplify what I'm asking, is sometimes you have a challenging patient with their family members. This exemplifies the nurse's self-control, one of our character strengths, a real big one with us. All of them are big with us. We're so good at this stuff, but this exemplifies our self-control. Another thing is when you question your career choice, things are getting hard. You're starting to wonder, should I be a nurse anymore? Or did I make the right choice? And then you remember your why. You remember why you went into nursing. And that is exemplifying your connection and your purpose. So in the chat, if you can let me know which character strengths you think arise in nursing frequently. And Ravi, is there any way we can go back to slide number 10 just to show them the character strengths? Oh, beautiful. Isn't Ravi the best? He really is. So please let me know. A little example. You think nurses arise frequently, almost daily. I would love to see what you guys come up with here. I'm really excited about this one. Now, I personally am a slow typer, so, and I'm patient because I'm a nurse. So I understand the slow typing. Hope and bravery. Yes, they arise don't they? Just almost every day for nurses, as well as frequently, meaning probably all throughout our day. Like we can pinpoint moments where we really needed a lot of hope, a lot of bravery. I love that answer. Yes, Ruby, I can absolutely explain it better. Out of these 24 things, which ones do you think arise the most frequently? You don't have to worry about giving the example of how to explain it. Just which ones do you think nurses demonstrate the most? And thank you for that question. Kindness. Yes, Melinda. Isn't that the truth? Kindness all day long, right? Probably even in our sleep, we probably have kind dreams. That's just the nursing heart. And I'm going to say this one for everyone. Humility. We don't like to be called heroes, but you are. Love and hope. Yes. Isn't that the truth? I love, kindness, hope, bravery. Isn't that just what we innately are born with as our strengths? I always find that so interesting for nurses. And that's why I work here at Nurse2Nurse, is because I know what is in my heart, and I know my experience, and I know that when another nurse is calling, I know they have the same exact heart and they have very similar experiences. We connect right away just on that. Stamina. Ain't that the truth, Luby? Even when we don't feel the stamina, we have to have it. Hey, she said stamina, not here though. You'd be surprised. It's the perseverance that gives you the extra stamina. Okay, going to the next one. If you guys want, take a screenshot of this. I can't highlight this enough. This is a book called Nursing from Within, a fresh alternative to putting out fires and self-care workarounds. These are those little things I was talking about, that simple, that make a huge impact. Okay. She goes into it a lot more, and she's done a ton of research, but it guides nurses and nursing students to a change in perspective in these challenging realities of being a caregiver. That's being a caregiver in our shoes as nurses. That is something special just to us. So we should read a book from a nurse who has done the research and has seen what works. This is what works. It's a very popular book, and I wanted to make sure you guys had that as a resource today. Okay, next, please. During these webinars, we always like to talk about a nursing heart story. What is a nursing heart story? It's defined as a moment when you witnessed a nurse caring for another in a way that touched your heart. I can think of a million stories right now, but I will use a simple one because I want you guys to have time to chat in. Working on the maternity unit, I spent a lot of time on the high risk unit. These were pregnancies, moms who weren't sure if they were they were having problem pregnancies. And a lot of them would stay with us for 4 or 5 months. And because of that, when I first started, I would think, oh God, that's rough. Yet this is really, these women are strong. And then what I saw the nurses around me doing, the veteran nurses, is they realized that these women would miss their baby showers, right? So guess what? The nurses, there were like 2 or 3 of them, they would put their money together and we would go in and we would have a baby shower right there in their room. To me, that is the nursing heart just shown in the most beautiful way. So again, we don't have a lot of time, but I would love to hear if even in 2 sentences, if you have something that you saw that demonstrated that you witnessed this beautiful nursing heart that we all have. Please. I'll give everyone about a minute. and we will be wrapping up. And I can't thank you guys enough for all of your participation. And I would say, and I will tell you this, and I'd like to highlight it, bold it, italicize. Thank you for showing up today for you. Remember that. You came today for you, for your wellness. And we would love to see you back here. Okay, as that is, I still would love to know your story. So if you're typing, go for it. But let's proceed to the next slide. I'm going to just say again, we have a lot of resources here. Phone numbers right there. And I'm just going to read what it says here because I think it is quite beautiful. The only way to do great work is to love yourself as much as the work you do. It's time to start supporting your own health and well-being too. You're there for them. Let us be there for you. Ravi.
All right. Thanks so much, Babs. We really appreciate all your insight and, just very, very helpful today's topic. For those of you that joined us, thank you. I see some comments that this has been very useful. And, some of us needed that today. So thank you all. You'll see also in the chat, there's a forms link. We're going to ask if you attended today to please complete the form. It's 4 questions. Question number 3 is, what is your email? And you don't always have to be contacted, but we just, for our grant and for the purposes of ensuring that, we're kind of keeping up with who's attending, or, how many people are attending, we'd ask if you could just click the link. And if you're interested in more information from Nurse2Nurse, whether it's a chat, an email, anything like that, all you have to do for number 4 is answer yes. If you just want to attend the webinars and you don't want to be contacted, that's fine too. And yes, we can definitely email you the link. Babs is going to write down that email for you, Sharon, so that her team can follow up.
Absolutely.
Link.
We're here for you.
And we really want to, again, say thank you. We appreciate your time. Know that our Nurse2Nurse call line is here for you. You can give us a call at 844-687-7301. Visit us on our website, nurse2nursenj.com. We offer these webinars monthly, and as we're heading into the summer months, we know that between coming into work more often, likely there's people who are either calling out or taking their time. A lot of you are likely going to be working, but we're going to encourage you to spread the word to at least 3 of your colleagues. So if each of you that are watching this, just say, hey, look up Nurse2Nurse New Jersey, get them onto our landing page, onto our website. Our goal is to support as many nurses in New Jersey as possible. We'd love for more people to attend, to see this, when it's saved, we can forward the links, but really just know that our Nurse2Nurse program is here for you. So with that, we want to say thank you. Be safe, be well, and we'll see you next month.
Take care of yourselves, guys. You're very important people, and take care of that nursing heart. See you next month, or talk to you soon. Thank you, Ravi.
All right, bye.
All right, bye.